Madam President, I yield the floor.
Madam President.
Senator from Idaho.
Madam President, before I make my remarks, I ask unanimous consent that Senator Reid from Rhode Island be recognized immediately following my remarks.
Without objection.
Thank you, Madam President. I rise today also to speak about a subject on the mind of all Americans, and that is the rollout of the Patient Protection and Affordable Care Act, or Obamacare. Many of us have predicted the implementation of Obamacare would result in difficulties for American families, businesses, and our still fragile economy. We spoke about the tax hikes that would come, to the rising premiums, the canceled policies, the benefit cuts to Medicare programs for seniors, and other problems in the flawed law. Still, the President insisted that he was right and that he knew best what Americans wanted. Since then, countless opportunities have been provided for our colleagues to join us in defunding or at least delaying the implementation of this damaging law. To further sow confusion, the administration has selectively changed the law to suit its political advantage. And now that October 1 has come and gone, millions of Americans are becoming painfully aware of the reality of how Obamacare will affect them. The American people are seeing the effects of Obamacare not based on the rhetoric of politicians or the debate here in Congress, but by their own personal experiences in dealing with it. The initial feedback is clear, and it is not pretty. The $1 trillion in new taxes that I led the fight against on the floor during the initial Obamacare debate are now largely in effect. And as I said, and many others warned, and the Joint Tax Committee has actually confirmed, a significant portion of those tax increases are hitting squarely on the middle-income families the President solemnly pledged to protect. He said that people in America who make less than $250,000 per couple or $200,000 per individual would not see one dime of tax increases as a result of the act. Yet now we are seeing that the square burden of this huge tax increase is falling squarely on those in what the President has defined as the middle class. The American people are also now experiencing for themselves the reality we have long warned against, that the President has also broken his promise that his health care plan would lower premiums by $2,500 on the average for Americans. In fact, the Washington Post fact-checker gave that President's pledge a 3 Pinocchio score for not being true. Yet another promise proven to be false is the President's pledge to the American people that if you like your doctor and you like your current health care plan, you can keep it. Again, the Washington Post reviewed this pledge, but this time it gave the President 4 Pinocchios, saying the President's promise apparently came with a very large caveat. If you like your health care plan, you'll be able to keep your health care plan if we deem it adequate. I recently received a letter from Nancy from Eagle, Idaho, about the loss of her husband's employer-provided health care coverage. The cancellation notification reads that due to the Affordable Health Care Act and unprecedented increases in health care costs, effective January 1, 2014, traditional comprehensive medical insurance will no longer be available. Instead, his employer will offer 2 preventive health care plans and referred him to the exchange to purchase his insurance. After browsing the exchange website, Nancy and her husband have realized they will either be forced to pay $500 more a month on health insurance premiums or pay a lower premium rate, which would result in limited access to providers and hospitals. Simply put, this is wrong. But I fear that there will be many more like Nancy with similar experiences. This week I was contacted by Matt from Meridian, Idaho, about his wife who receives coverage through her employer. They will see their premiums rise and a considerably higher deductible due to the increased cost to her employer because of Obamacare. Just 1 month after the Obamacare exchange rolled out, at least 3.5 million Americans have received insurance cancellation notices, and this number is expected to dramatically increase in coming months. Over 100,000 of those people live in Idaho, according to the Associated Press. According to media reports, the administration knew that Americans would not be able to keep their current coverage, even though the President continued to push the message that people could. After breaking this promise, the President is now telling millions of Americans who have had their insurance canceled that they should shop around for policies that, frankly, could be more costly and require them to change their doctors. Many of my colleagues here in the Senate, as a response to this, are co-sponsoring a measure known as, if you like your health care plan, you can keep it. This act is one that the Senate should immediately take up and pass. Idahoans are now learning that the flawed health care law will force them to change their plans, in many cases paying higher premiums. While this law was sold on the premise of providing health care coverage for the uninsured, it is creating new uninsured Americans who will be forced to enter the troubled federal health care exchanges. At the same time, the administration refuses calls for transparency and hides information about enrollment numbers. It's hard for me to believe that in the year 2013, when we have iPhones, tablets, Twitter, and Google, that the administration has no idea or ability to release enrollment numbers. According to documents released recently from the House Oversight Committee, 6 people signed up for Obamacare on day one. We understand that more are signing up now, but it could be that the administration has such low numbers of enrollment for their signature achievement that they don't want to present the accurate facts. Many of us here in this body are concerned also about the security risk posed by Obamacare. Several weeks ago, Republican members of the Senate Finance Committee wrote to the Department of Health and Human Services Secretary Kathleen Sebelius asking whether all federal privacy and security standards were met prior to the launch of healthcare.gov, the website to sign up for Obamacare. We've asked Secretary Sebelius to provide answers and information to a series of questions detailing what level of security and privacy measures were undertaken prior to the launch of the website to safeguard the privacy of those Americans signing up for coverage through healthcare.gov. This is a serious concern that must be addressed. Additionally, because of the law, some businesses are cutting back on employees and on hours, making it harder for Americans to find full-time jobs. And those who do hold on to their full-time jobs could lose their employer-sponsored private insurance and are instead being dumped into the exchange or into a failing Medicaid system. These are just some of the unfortunate realities that we are facing with the implementation of Obamacare. As these stories continue to pour in, I urge all my colleagues on both sides of the aisle, along with the President, to carefully listen to the American people, to the American businesses, and others that take this feedback and work together to defund and repeal every element that proves not to work. We must replace those failed policies with true reforms that are in the best interests of the American people and in the best interests of the American economy. From day one, the administration has continued to make excuses for why healthcare.gov is not functioning properly, even though they have had 3 years to prepare and perform testing. The American people see now that this law is more than just a website problem. It is a train wreck. And this system was not ready, and the law looks impossible to fix. Simply put, the promises of this law are nothing like its realities. Thank you, Madam President, and I yield the floor.
The senator from Rhode Island.
Madam President, I rise to express my deepest sympathy to the senior senator from Oklahoma, Senator James Inhofe, and his wife Kay on the sudden and untimely loss of their son, Dr. Perry Inhofe, this weekend in a plane crash. And I extend my thoughts and prayers to the entire Inhofe family. Perry Inhofe was an orthopedic surgeon as well as a licensed pilot and flight instructor with a family of his own. Flying is integral to the Inhofe family. I know that from my service with Senator Inhofe on the Armed Services Committee as co-chair with him of the Army Caucus, a caucus he created along with Senator Dan Akaka to support the men and women serving in the Army. And I know of his intense involvement in flying. And I hope certainly that the memories and time he had with his son will help sustain and comfort him in the days ahead. Senator Inhofe is a man of great integrity, great dedication to his state and to the nation. And at this time of loss, again, I only hope that the memory, the example of his son's service and his courage and faith and love will sustain the Inhofe family. Madam President, if I may, on another matter, it's clear that we have honest disagreements about how we should address our budget. I believe the path forward should be fair and balanced, and that's not what we have seen to date. We've enacted $2.4 trillion in deficit reduction, with $1.8 trillion coming from spending cuts. These cuts put tremendous pressure on important domestic investments in areas like education, health care, and national security. I don't believe that cuts to domestic programs that invest in our future and help low and middle income American families is the right thing to do, especially when we can close egregious tax loopholes that benefit multinational corporations and some of the wealthiest Americans. Again, we have made significant progress in deficit reduction. The bulk of that has been cutting programs that invest in the country and help families. To go forward, we need a balanced approach. Selective cuts, but also closing some of these egregious loopholes that are benefiting not the small businessmen and women in Rhode Island, but multinational corporations, not working wage earners in Rhode Island, but some of the wealthiest Americans. I know some of my colleagues disagree with me, but in order to address our long-term fiscal challenges, the brinksmanship has to stop. The drawing lines in the sand and daring people to cross them has to stop. What we need is not to surrender our principles, but to reach principled compromise. And that's why we should provide, I think, immediate certainty that the shutdowns and threats to wreck the economy are totally off the table. And we can do this by agreeing to adequate top-line numbers for the appropriations process for fiscal year 2014 and 2015 and eliminating the job-killing sequestration. And we can move forward to a long-term debate about our fiscal challenges. We can then build consensus and reach this principled compromise. And in reaching that compromise, I would urge my colleagues to include policies that focus on jobs and economic growth, that restores fairness to our tax code and preserves hard-earned Medicare and Social Security benefits. Looking over the last few years, the uncertainty, the brinksmanship, according to most economists, has robbed us of growth. That growth in and of itself not only would have put more Americans to work, but it would have contributed to deficit reduction even more than we've already been able to do. And so if we're really serious about deficit reduction, if we're really serious about narrowing the gap in terms of equality in our society, then we have to emphasize not only wise fiscal policies that reduce the deficit directly, but wise fiscal policies that encourage growth and also reduce the deficit. So let us agree to these top-line numbers. Let's also eliminate the sequester, and let's move forward. That's why we're sent here. Americans want us to keep the economy moving forward and to get the economy working for them. They don't want us to see us engaged in procedural maneuvers that simply leave us without adequate progress on these extraordinarily important issues to them. We are recovering from the most recent self-inflicted wound, the government shutdown, and near default. That manufactured crisis was absolutely unnecessary, and particularly unnecessary to threaten the credit of the United States. A vast majority of Americans are clear that at a minimum we should keep the government open and we should pay our bills. We've always done that. Only in the last few years, and harking back to when Speaker Gingrich was Speaker, did we engage in a government shutdown. It just doesn't really work for Americans. They do understand we have differences in policy. They do understand that we have to debate various these differences, but as a threshold level, government has to be working for them, not sporadically, but constantly. And we can't threaten the credit of the United States. Now, jumping from these crises to crises, these manufactured crises, is just simply no way to do the job. And as I said before, there are immediate tasks before us. We have to have a reasonable expenditure level for our budgets for FY14 and 15. Sequestration must go. And then we have to start looking at longer-term problems that are being driven by demographics. We know the sequestration is harming our job growth. CBO has estimated that the 2013 and 2014 sequestration will cost the economy 900,000 jobs. Simply by eliminating sequestration, if we can generate 900,000 jobs, most Americans would say that's the right policy. If you can just do that and create jobs, then do it. And it's obvious that sequestration is not workable. The House of Representatives, our colleagues, have had very difficult times passing bills that adhere to sequestration, bills that traditionally pass overwhelmingly, transportation bills, infrastructure bills. And if we can't do that under the pressure of sequestration, then, again, we're back to a dysfunctional government. You know, it might be formally open, but it's not helping people do things we have to do. Economies grow. States build bridges and sewers and highways. Now, Senator Mikulski has done an extraordinary job as chairwoman of the Appropriations Committee. And she has been working hard to make sure that we bring bills to this floor that not only have the support of our members, our colleagues, but also meet the needs of the American people. Now, I have the privilege of chairing the Interior Subcommittee. We have been able, working with my colleague, Senator Mikulski from Alaska, to propose, we haven't brought it through subcommittee or full committee, but to propose a mark that would respond to the real needs of this country in terms of sewer construction, in terms of many programs that are vital to the economic vitality of every American community. On the other side, the House is talking about a cut in funding of $1.756 billion, more than 75%. It just devastates the programs. It would mean 97,000 fewer jobs than the Senate proposal that we are trying to advance. And these are the good kind of construction jobs, high-paying jobs that allow families to stay above water and allow communities to prosper, because those workers that are putting in those infrastructure projects are also going to local supermarkets, to local restaurants, you know, paying the fees and dues to the Little League teams. And they're doing the things that we expect every family should be able to do, and we hope every family can do. In the transportation bill, for example, we were able to maintain our promises to fund transit, airport, and highway systems, and we've been able to set aside more than $1 billion for the Popular Tiger program, which is an effort that has benefited every state in this country in terms of infrastructure projects. Looking across the Capitol at the House Republican transportation bill, they're cutting by $7.7 billion, even more than last year's sequestration level. It not only eliminates Tiger grants for 2014, it reaches back to 2013 Tiger grants and cuts them by $237 million. And these kinds of cuts are untenable. And they also signal a very different attitude here. It was at one time clear that transportation was one of those issues that united us, Republicans, Democrats, the North, the South, the East, the West, because it was something that every community needed and every community understood. And now we see this dichotomy, and that is unhealthy for our government and for our economy. House Appropriations Chairman Hal Rogers said at the time when they were bringing this up, with this action, the House has declined to proceed on the implementation of the very budget adopted just 3 months ago. Thus, I believe the House has made its choice. Sequestration and its unrealistic and ill-conceived discretionary cuts must be brought to an end. So even the chairperson of the House Appropriations Committee is signaling that sequestration is untenable and unworkable. And on this side of the aisle, Chairman Mikulski has been a strong voice echoing, not only echoing, but asserting that position constantly. But we can't get rid of sequestration with spending cuts alone. We can't cut our way to prosperity. Revenue has to be part of the solution. In fact, as we've done over the last several years, we have cut discretionary spending dramatically. We're down to not fat but bone, and so we need additional revenues. But there is some good news. There are some loopholes, egregious loopholes, that in and of themselves should be closed. Regardless if we were dealing with an issue of deficit and sequestration, they're just not appropriate. They're not efficient. They don't add to the overall economic productivity of the country. They do benefit very narrow interests. And so it comes down, I think, to whether my colleagues on the other side of the aisle are willing to see these special preferences prevail, or whether the national economy and the families across this country will benefit. We have to move forward. We have to emphasize things that will help us, for example, create more manufacturing jobs in this time and for the future. I think at one point we thought that manufacturing was passé, and we discovered it's not only not passé, but it's absolutely vital, because you can't take new innovation, new discoveries, which we're so good at, and commercialize them, and then find out new products in that commercialization process unless you have manufacturing. We learn a lot on the manufacturing floor. We've discovered that when we've looked around and seen products that we've developed intellectually become sort of not only used but improved by people who have the ability to manufacture them. And we have to get back to do that. We've got to be able to align our workforce and our education system so that we have the skills in this next century. And this job training has to be constant and has to be efficient and adequate. All of this requires investments in resources, not simply cutting away and cutting away and cutting away. And then, ultimately, as we understand, and as our predecessors, and particularly my predecessor, Senator Pell, understood, education is the engine that pulls this country forward. We used to assume we were the most educated. We were the country with the best record of college graduates. We were the country that invented public education for everyone. And now we look around the world and we've slipped in terms of college graduates. We've slipped in terms of skills. Our public education system needs to be reinvigorated. And it's not just with, suggestions from the sidelines. It's not just with new approaches. It's also with real resources. And these investments have to be made. It's a multifaceted approach. But I think we have to begin with just the simple understanding as we go forward. We need to provide the economy, our constituents, and ourselves the certainty of an adequate funding levels for the next 2 years. We need to suspend, dispense with, postpone, whatever the appropriate term, sequestration, because it is not going to help us grow the economy. In fact, it will take away about 900,000 jobs. And then we have to certainly make it clear that we will not threaten the creditworthiness of the United States by defaulting on our debt. If we can do these things, and I believe we can provide the certainty that our private entrepreneurs need to make real investments in the economy and to grow it. And in all of this, we have to bring a balanced approach. It's not just cutting, it's expenditure cuts wisely chosen together with revenue wisely chosen through closing loopholes that'll get us a growing economy, hopefully increase opportunity, and put us back on the path to profound, sustained economic recovery. And with that, Madam President, I would yield the floor.
Under the previous order, the Senate stands in recess until 2:15 p.m.
The Senate taking a recess now so members can attend their weekly party caucus lunches. They'll return at 2:15 p.m. to continue work on the pharmacy compounding bill. Live coverage when they gavel back in. More now on this bill and the procedural situation with the Capitol Hill reporter.
Noah Bierman covers Congress and politics.